Hello, everybody, and welcome to this edition of the Taking Control of Your Diabetes podcast. I am one of your hosts, Dr. Jeremy Pettus, joined as always by my good friend and colleague,
Dr. Steve Edelman.
As he swallows a drink of his iced coffee. So if you're just tuning in, Steve and I are both endocrinologists. We work at the University of California, San Diego. We've both had type 1 since we were 15 years old and work at the organization Taking Control of Your Diabetes, which is putting on this podcast, as well as all kinds of other online virtual content. So this podcast is on insulin pumps in people with
Type 2 diabetes.
And there's the big caveat, type 2 diabetes. So we talk a lot about type 1 diabetes and insulin pumps and how, beneficial they are. But this podcast is going to focus exclusively on if you're listening and you have type 2 or a loved one with type 2, could an insulin pump be right for me? How are these pumps different than what might be available for type 1? How might they be the same? So, quickly, pumps have become kind of standard of care for people with type 1 diabetes, and particularly now as they integrate with continuous glucose monitors. So we all know we've had these CGM systems for a long time that measure glucose. They do a really good job of measuring them accurately. And we've had insulin pumps for a very long time. But it's only recently that those things kind of communicate, and our new pump systems will respond. As your blood sugars are going up, they'll give you more insulin. As they're going down, give you less insulin. That's what we call hybrid closed loop pumps or artificial pancreases. And again, if you have type 1 or know somebody who does, we've been talking about this for a long time. But the question here is, why can't people with type 2 diabetes use them? Should they be using them? When should they be using them? Are there certain pumps that might be better for type 2? So, Steve, what do you think?
No, I think you did the great introduction. They've been using pumps in type 1s like you and I for a long time. Before they communicated, we called them dumb pumps. Now that they communicate together, the CGM and the pump, it's what, like you said, hybrid closed loop or automatic insulin delivery. And these systems are tremendous. Now, type 2s, believe it or not, have been using pumps for a long time. The numbers are much smaller. I would say that many people with type 2 diabetes do not know about them, and many primary care physicians and even endos are hesitant to use them. Mm-hmm. So I think it's time that we introduce this type of insulin delivery to people with type 2 who need it. And I know you had some comments to talk about type 2 and insulin.
Yeah. Well, first, let's be honest. There's a stigma that these systems are for type 1s, right? They're the ones that are younger and tech savvy, and they like these systems. And type 2s are older, and it's going to be bothersome to them. And let's not, overwhelm them with this technology.
They're not smart enough to use them.
It's completely bogus. So a good amount of people with type 2 will go on insulin. So we're going to talk about when a pump might be beneficial. But first of all, there are some important differences between type 1 and type 2 that we need to talk about. Namely, everybody with type 1, when they're diagnosed, they need insulin, and they need it lifelong. So pretty much right away, a pump comes into the conversation, and people might be on pumps lifelong. In type 2s, I'm jealous that there's other medications that are available. It's not just simply an issue where your body doesn't make enough insulin. There's issues with insulin resistance also. That's why type 2s can benefit from these other drugs that we spend a lot of time talking about, like Ozempic and Mounjaro. I mean, you can't turn on the TV or the radio without hearing about these medications now. So if you have type 2 diabetes, the kind of algorithm, what we call the treatment approach to people with type 2 diabetes, is essentially this. Ready for a rapid fire treatment algorithm, Steve?
Yes, yeah. I am.
So you're newly diagnosed. You need education on diet, exercise, the kind of basics of diabetes. Then people are generally started on a pill called metformin, which helps in multiple ways, but one of them is maybe to improve insulin sensitivity. And then people quickly get on these medications like GLP-1s, like Ozempic, and SGLT2s, like Farxiga. And you want to maximize those medications because they help people lose weight, they can help with insulin sensitivity, and you might not ever need to go on insulin. That being said, the vast majority of type 2s eventually need insulin. And when you do start an insulin, it typically starts as a once-a-day basal injection, like Lantus or Tresiba or Toujeo. And then if you can't, your blood sugars after meals become a problem, your provider might start you on mealtime injections of insulin also. So if you're listening and you're saying, hey, I'm on insulin at meals, I'm taking an injection before every meal, you're the person that could potentially go on to a pump.
Yeah, but let me just add, Jeremy, that even if you're someone who just needs basal, a pump may be very beneficial and easy for you to use. Anybody listening that has type 2 that takes at least one injection a day, and probably basal if they're only on one, is a candidate to get a continuous glucose monitor, which is awesome news for folks with type 2. So you mentioned about how things change over time. And so the pancreas's ability to secrete insulin in type 1, once you get type 1, you're pretty much gone. You don't secrete.
Yeah, you and I are screwed.
But with your type 2, you actually are able to secrete a good amount of insulin, but that goes down over time, which means that if you're a healthcare professional or an endocrinologist, you're kind of treating a moving target over time. That insulin requirements will go up if you're at type 2. And like you mentioned, basal may be great at first, but then fast-acting insulin. And if you're not on a system that is communicating with the CGM, you've got to do a lot of dosing yourself, finding out the right dose. So the advent of these pumps for type 2 also have hybrid closed loop systems that will make it easier for people with type 2.
Yeah, and you mentioned that, as a provider, it might be difficult because you're treating this moving target. But, we don't say enough as a patient that you might feel like you're failing. I started with diet and exercise, and that was enough. Now I need metformin. Now I need this other injection and this other pill. And now they're saying I need insulin, and now I need an insulin pump. That's because over time, the cells that make insulin in your body do die, and you might need more quote unquote help to control your blood sugar. So it's definitely not unusual. Actually, I said, and I'll say it again, the vast majority of people with type 2 eventually will need insulin.
Yeah, and typically, you mentioned the word insulin resistance. I think it's generally well known that people with type 2 need more insulin compared to people with type 1, which has implications on the reservoir size and other issues that we use when we treat type 2 with pumps is that they may not need all the intricate settings that we use in type 1. For example, you may not need to do carb counting. You might need to give yourself just a pretty good slug of insulin before meals. You don't need multiple basal rates from in an insulin pump and things like that. Now, Jeremy, it's a good idea to tell the folks listening that how these pumps work, meaning that what do you put inside them? You're not using long-acting insulin anymore. Since you're a pump specialist and I taught you everything you know, why don't you explain it?
Okay. Well, I'm still learning from you, Steve. So let me know if I do a good job here. So that actually is a really good point. And we're telling this to our trainees or our medical doctors, we call them residents and fellows all the time about how does an actual pump work. So basically you need a basal insulin, which lasts all day long and gives you kind of like your baseline metabolic needs for insulin. And they need a bolus insulin, which is an insulin that gives you, insulin for your meals. So if you're on shots, that's usually two different shots. You got your long-acting shot and you got your short-acting. In a pump, it's all short-acting insulin that works as both. And what I mean by that is that it's rapid-acting insulin that's dripping out very, very, very slowly over time. Let's just say like a unit an hour. And that provides your baseline or your basal amount of insulin. And then when you eat, you can tell your pump to give you that bolus of rapid-acting insulin to cover your mealtime. So it's one type of insulin in a pump that serves dual purposes.
That's exactly right, Jeremy. And I'm sorry, I forgot to mention it in the beginning of this podcast, but to give you an idea of some of the differences between type 1s and type 2s, folks with type 1, like Jeremy and myself, we use approximately 40 to 50 units a day. And of course, that varies between people with type 1 and people with type 2 typically use 70 to 90 units a day, combining both the basal requirements and the pre-meal. But that can also vary quite a bit too. So I think there are differences. And what we're going to do now, we're going to quickly walk you through the common pumps that are used in people with type 2 diabetes and end with a new patch pump for type 2s coming out from Embecta. So I'll start off with talking about the Vigo patch pump. This has been around for a long time. It's not marketed to any great degree. Believe it or not, it's owned by a company called Mankind, the makers of Afrezza. It's a small patch pump that you fill up, and it has two different reservoirs. One holds the reservoir for the basal rate, still fast-acting insulin, and a different reservoir that holds insulin that you use before meals. When you put it on once a day, it has automatic basal rates. And I told you earlier that the basal rates can be pretty simple. And these little Vigo patch pumps come in 20 units per 24 hours, 30 or 40 units per 24 hours. And your healthcare provider helps you pick which one to get. And then when you eat a meal, you push a little button on the side of it, and it gives 2 units at a time. And that reservoir holds 36 units. So the reservoir may or may not be big enough for someone that takes more than 36 units a day of fast acting, but that's neither here nor there at this point. But it is a little patch pump that you put on every day. And I remember, Jeremy, you actually wore this as a type 1 just to experiment early on.
Yeah. I wore it for a while, and I really liked it. And I think, I think it kind of bucks the trend that we think type 1s want these really sophisticated devices and type 2s don't. I really enjoyed the simplicity of this device. I would fill up a few of them at a time, put them in the fridge, every night put on a new one, and, didn't get any alarms or anything like that. And I would just click it every time I wanted to, get 2 units. So if you're a type 2 out there and you're taking, I don't know, somewhere between like 10 and say 60 units of basal insulin, this could be a good option for you,
Yep.
the Vigo pump. So moving on, another one that's actually different is called the Simplify, which is made by a company called CGMs. And this is what they call a patch pump that's only for mealtime bolusing. So you would still take your once a day shot of basal insulin, but then you fill up this little patch pump, and people generally wear it on their arm. And then every time you click it, you kind of just literally click it on your arm, it gives you 2 units of rapid acting insulin. So the benefit here is that you can wear it for several days. And instead of having to get out your pen or your vial and syringe every time you eat, it's just on your arm. It's got a reservoir of insulin there. You just click it. Okay, 1 click will give me 2 units. 2 clicks will give me 4, so on, so on, so on. So it's a nice way to kind of discreetly and easily deliver mealtime insulin. So it's not like a full-on pump. It's more of like a convenient way to deliver mealtime insulin.
Yeah, and remember that if you have type 2, you may only need mealtime insulin. I know you talked about the chronology that basal is typically first, and that is totally true. But some people just need to knock down their blood sugars after eating, and they don't even need a basal. And of course, they're probably taking other medications. So, but if you do need a basal, and you just take that once a day, Toujeo, Tresiba, Lantus, and you put on the patch, the bolus patch pump. It's not really a pump, as you said, but it saves you from pricking yourself 100 times a day. And if you're wearing a CGM, or if you're unfortunately pricking your finger, it saves you those hassles, and you can really stay up on your blood sugar elevations after eating. You can use it for correction doses if you've eaten too much birthday cake, things like that.
Yeah. And, it's worth taking a second to say, what problem are you really trying to solve here with the Vigo and this Simplify thing by CGMs? It's really that we know that people don't like to carry insulin with them. They don't like to take injections, particularly for lunch or when they're at work, things like that. But having something on your body that you can quickly deliver insulin with can really help people stay on top of their blood sugars in a discreet and kind of easy to use way.
Yeah, it's really ergonomically well designed. It's very flat and smooth. And you use this when you go to Hawaii as well.
I've used this also. I've used all the systems that we're going to talk about.
You're
today.
always jealous of us type 2s. Hey, no way. You're always jealous of type 2s. They're meds, now they're devices.
Well, I just think like all these things can, like for the right person, they have their fit. When people say, what's the best pump? There's no answer to that question.
It's choices.
All these different choices. All right. So talked about the Vigo, Simplify. These are simple kind of pumps. Now we're going to jump to the other end of the spectrum. Yeah.
Well, I'm going to introduce the modern Omnipod 5 system, let you discuss it. But I should say for you listeners that may be on an older system called the Omnipod Dash. It communicates with a handheld locked down Android phone that allows you to change the basal rate and give yourself boluses, but it's not a hybrid closed loop system. So it's kind of an antiquated system. And I think everyone's turning to what Jeremy's going to describe as the Omnipod 5.
Mm-hmm. So what is Omnipod 5? It's a system. Well, it's two parts of the system. One is the actual pump, which is a pod, and I don't know, it's about the size of an egg, maybe a little bit smaller. You can fill it up with 200 units of insulin, and you wear it on your body. Again, people typically wear it at the back of their arm, but you can wear it on your stomach or your hips, wherever you want. And depending on how much insulin you use, that pod could last 2 days, it could last 3 days. And so the pod is the one that's delivering insulin. It's filled up with insulin. And then you also wear a Dexcom continuous glucose monitor. You can wear a G6 or a G7. And these devices communicate with each other. So namely, like I said a little bit earlier, that let's say your blood sugars are creeping up a little bit higher, the pod can give you these kind of mini or micro boluses to bring you back down into range. And if you're going low, it can shut off the insulin so you don't have a bad low, or hopefully avoid the low altogether. Now, the system is not sophisticated, and none of these systems are sophisticated enough yet to just completely handle meals. So you still have to tell it you're eating, enter how many carbs you're eating for a particular meal, so you still get that bolus. But it can really help with like glucose trends. I'm drifting up overnight or drifting down. And we know that these systems improve, blood sugar control. So when I say this is more sophisticated, it's doing, the basal, the bolus, it's working with the CGM. It has this integrated like glucose feature. So this is a nice option. Steve?
Yeah, I was going to mention that when you go on a pump, typically you have to set up some features such as your insulin to carbohydrate ratio, your insulin sensitivity factor, and your basal rate. And what glucose level do you want your system to target? So I don't want to overload everybody here that's not privy to all the settings of a pump. But when you put on an Omnipod 5, it looks on how much insulin you are needing over the past. And that's how some of the systems work. And it takes over these settings for you. So you and your healthcare provider might be putting in some basic settings, but when the system is automatic, it's doing all this for you. And it's really quite easy. When you go through all these settings, you might say, oh my God, I can't handle this. But trust me, you can. And within 1 or 2 days, you'll see how well these systems work.
Mm-hmm. And I'd say already, if you're saying, gosh, there's all these options, my provider has never mentioned any of these to me, and I'm on insulin, that's not uncommon. I do think there's definitely a bias that providers don't bring up pumps with type 2, so you have to advocate for yourself to go over these.
Well, Jeremy, you remember when continuous glucose monitors came out? Only for type 1s. Mm-hmm. And only for type 1s that had severe hypo. And of course, you and I have been talking about being a standard of care for a long time, and it's the standard of care for type 2s. You and I have always said that, even if you're not on insulin, but you won't get it reimbursed unless you are on insulin. So ask your provider to put you on 1 unit a day if your blood sugar is over 6,000. So he'll write a prescription and you'll be eligible. And you said that, not me.
All right, tell us about this new patch pump, Steve.
Yeah. So Embecta, which is a company, a relatively new company that used to be part of BD. Everyone knows BD because the needles, the pen tip needles, the regular syringes. And this company has developed a patch pump, and it has some unique features. It doesn't even have a name yet, but it's coming out soon. And so I'm going to call it the Embecta patch pump. I'd say right away, I just want to say that it is very easy to use. It's good for patients who need basal only or bolus only or combination of both of them. Now, the first iteration of the Embecta patch pump, it's not going to be communicating with a CGM. So for patients that go on it with type 2, they'll prick their finger, or hopefully they'll be on insulin. They're eligible for a CGM, and they will make their own decisions, and they'll work with their healthcare provider to figure out, how to set the basal rate and the insulin to carb ratio and the sensitivity factor on their pump.
They could still wear a CGM. It's just not necessarily going to communicate with it right away.
Yeah. Thank you. I thought I had that perfectly clear, but that's okay.
Talking about pricking your finger, we don't want to do that.
No, but I'm just, there are some type 2s out there with terrible insurance. Well, if your insurance covers the Embecta patch pump, they should cover a CGM. And so at that time, for the first model that comes out, but very closely following that, it's going to be communicating with a continuous glucose monitor. And we don't know which even CGM device is going to be hooked up with the Embecta pump, but it's going to be one of the good ones that are out there now. And it'll do all the features that we've talked about in the Omnipod 5, which is officially approved for type 2, and so is the Embecta. And it turns out that both the Omnipod 5 and the Embecta patch pump is available and approved for type 1s as well. But the primary patient that they are trying to address is the person with type 2. The first unique feature is holds 300 units. And that is nice because type 2s use more, as we talked about earlier, and you won't have to change out your pod as often. And filling up a pod, I should say, is quite easy, whether you're talking about the Embecta pump or the Omnipod. These little patch pumps come with a syringe and a needle, and you put the needle in a vial of insulin. You pull out the insulin, you squirt it in the bottom, then you pull off the stickies on the bottom of the patch pump, kind of like a Band-Aid, and you just put it on wherever you want. And you mentioned earlier that you can put it in lots of different places. I would say you have more real estate to use than if you're using a traditional pump with an infusion line, and you have to find a place where you can reach yourself. So it's really quite flexible depending on the need of the person with type 2 diabetes. And this pump stays on for 3 days. And the FDA allows it to go for another 8 hours. So that's 72 plus 8, that's 80 hours, and then you have to put a new one on. And putting on a new pump is quite easy and quick. And once again, you can hide it under your clothes. If you want to wear it proudly, you put on your muscle shirt, Jeremy, that's sleeveless, that you wear to the gym, and you can put it on the outside of your arm, and everyone says, "What's that?" And you can make up all kinds of stories.
Well, this isn't available yet, right?
That's right. As of today, which is September of 2024. It is approved by the FDA. They're producing these devices, these patch pumps, as we speak, and they should be out very shortly. I should say that in the beginning, when they have the initial version that is not a hybrid closed loop communicating with the CGM, you will be wearing a CGM if you're a candidate for insulin. You'll have kind of what they call a lockdown phone, and that is a handheld, what looks like a phone, but that's the controller where you change the basal rate, where you give yourself boluses, and you make any adjustments. And so that'll be coming with it as well.
Mm-hmm. And it's worth saying again that we're spending a little bit more time on this because the real design and the concept behind it is for people with type 2 diabetes. And, hopefully this will be available soon, and just to help get this concept out more, like we said, that this is a viable option. And all these different systems, I think, are just generally not talked about enough from providers to patients with type 2. Yeah,
and I should say that, you've tried the Vigo, which gives 2 units at a time. Simplify, which is the little patch bolus only pump, that gives 2 units at a time. The Embecta pump gives 2 units at a time when you give a bolus. And so most of the folks that use a type 1 oriented pump will give 1 unit can give 1 unit at a time or less. But I think you would agree that you and me, even though our insulin requirements aren't, extraordinarily high, 2-unit bolus is not a big issue for us. I mean, how often do you give 1 unit of insulin?
Yeah.
Not very often. So that's why they're also approved for type 1 as well. There may be type 1s out there that have higher insulin requirements, and they don't want to run out of insulin and change their patch pump as often. So even though they're focusing on type 2s, the simplicity, the versatility of it based on the insulin needs of someone with type 2, it still is a good option for people with type 1.
Yeah. All right. Well, any concluding remarks, Steve, on this overall topic?
Well, I'll probably repeat something you said earlier, which is genius, is that, people with type 2 could do very well with insulin pumps. If you're someone that's maximized on your non-insulin therapies and you're taking them as prescribed, you've come to the end of the limit with adding non-insulin medications. I don't want to make it sound that bad, but if you are, going on a pump that's designed for type 2s makes perfect sense. Just makes your life that much easier. You don't become a pincushion. And I would guarantee that your control will be much better, so much more convenient. So many of my type 2 patients say they forget their insulin during the day when they go out and eat, and as a type 2, if you do forget, you're not going to crash and burn like maybe someone with type 1. But it allows you to just give insulin when you need it at the time you need it in an easy fashion.
Yeah. And how many of these talks have we done for type 1, updates on technology, CGM, like whatever. And I think we're a little bit guilty too of that. This technology is really for everybody, especially CGM and then now pumps too. So if you're listening, 1, get on a continuous glucose monitor. If you take insulin, that's a must. And then 2, ask your provider about an insulin pump. And if they tell you, no, get a new provider.
Yeah.
Honestly.
Yeah, absolutely. Jeremy's clinic number is
555
657 1636. Okay.
Well, thank you all for listening. As always, Steve, it's fun doing this with you. And if you like it, please like it, subscribe, follow, share, do all those things, and donate. Absolutely donate. We do all this to deliver to you free of charge, but we get by on your donations. So go to our website, TCOYD.org, click on donate. Also check all our videos online there at the Video Vault, and we will see you on our next podcast.
Thanks, Jeremy. Thanks, everybody.